Welcome to the Brown Bag Lunch Training Series, a training series on health and policy topics affecting children and youth with special health care needs. Our presentations are geared towards families, professionals, parent-to-parent staff, youth, and anyone else who would be interested. Today's topic is on getting basic health care services and medically necessary treatment from your health plan. We welcome Susan Berger and Lynn Gage from the Department of Managed Healthcare. Let me just give you a few notes about the technology today. Unless you're absolutely sure that you have a headset with a microphone that allows you to speak through your computer, you'll need to either call in or type in your questions. You can find the call-in number from your confirmation email, or while you're connected, you can go to the audio menu, select Use Telephone, and it'll provide you with a dial-in, access code, and audio pin. Remember to enter the audio pin if you are connecting by telephone. And if you have any additional technical difficulties, you can either call GoToWebinar directly. The number is 1-800-263-6317, or you can send me, Tara Robinson, a chat or a question. So owing to feedback issues and the fact that we have a lot of people on the line, we generally have everyone on mute. So there will be time to ask questions at the end of today's webinar. Since there's a lot of material to cover, we ask that you hold your questions until the end. And at that time, we'll call for people to ask questions. And when you want to ask a question, you select the little hand icon in the control panel. It's a small column to the left of the menu. It's a little hand with an arrow. If you click that, then we know that you want to be unmuted and you have a comment or a question. And if you have any problems asking questions orally, you can also type in questions at any time. And so, as I mentioned, we'll provide you an opportunity to ask questions at the end. With that, and we will be providing you with the PowerPoint slides and a copy of the presentation today. That's always the first question everyone asks. So with that, I'm going to go ahead and turn it over to our presenters. Welcome, Susan and Lynn. Thank you for being here.
Hello.
Our pleasure. Thank you for asking us.
Yes, thank you. We're really pleased to be able to provide this presentation to you today, especially to share what our department does and how we can help you. The department, also referred to Department of Managed Healthcare, also referred to as the DMHC, which we may say sometimes throughout the presentation, we work to ensure that managed healthcare enrollees get the right care at the right time. And the department shares responsibility with everyone in the managed care system to ensure aggressive prevention and high-quality health care. And we provide regulatory oversight of California's health maintenance organizations, or HMOs, and the PPO products for Anthem Blue Cross and Blue Shield. The department is here to ensure that managed health care plans follow the law and address enrollee complaints on time. In this presentation, we're going to share tips on how the enrollee can navigate through the managed healthcare system. We'll also share how the department's health center can assist you in obtaining basic healthcare services and medically necessary treatment from your health plan. We're going to explain your enrollee healthcare rights and how to be a wise patient, how the department can help you with problems and questions, how you can file a complaint with your health plan to resolve a problem, and what do you do if the requested treatment or service has been denied, delayed, or modified by your plan. And one thing I'm going to say before we go further, you will, as Tara mentioned, you are going to get a copy of our PowerPoint presentation. But also, the information we're sharing today is available on our website. And I'll say it, the website now, address, and later on at the end we will also do it. It's www.healthhelp.ca.gov. So healthhelp.ca.gov. So if you miss anything we're talking about today, you need further clarification, please feel free to go on our website because more information is there for you to gather. Okay. We want to highlight a few helpful strategies that you can use to help you get the health care you need. And more than likely, you've all heard these strategies before, and you may be regularly using them yourself, but they're worth repeating, and they're definitely worth sharing with other individuals you know who may be currently struggling with getting the health care they need. Getting the right health care at the right time begins with each enrollee. And our first strategy, enrollees The first strategy they can use is taking responsibility for their health care. Be proactive. Well, how can you do this? The first and foremost point, and important point, is read your evidence of coverage booklet. It's also called the EOC. Read it thoroughly. The EOC contains information on what benefits the plan covers and what benefits they do not cover. The EOC also provides information on co-payment requirements, steps you need to take to get prior authorizations for treatments, procedures on how to file complaints with your health plan. And it's important to note that the benefit coverage does vary from plan to plan, so you may have a different product. Even within the plan, you've got to look at the evidence of coverage that pertains to you. And if you don't have the EOC, or you have questions about the coverage you read in your EOC, or need clarification, call the plan's customer service line. And those phone numbers are usually on your ID card, or they're listed in the EOC booklet itself. Another important strategy to be responsible for your own health care is partner with your doctors. You know, your primary care doctor gives you the basic care and oversees your treatment. And doctors must help you to get the services you need and understand your care. So don't be afraid to ask them questions. They're there to help you. Another strategy, research to gain understanding. Make sure that wherever you're researching, it's a reputable source. We've all been on the internet. We all know that some sites are more reputable than others. Just be very conscious of where you're looking and gathering information. And also, you have the right to be informed by your doctor of all the treatment options available to you regarding your specific health condition, so that's a source of information as well. You want to make objective decisions. The doctor, as I said, tells you of the different treatment choices, even if they aren't covered by your health plan. And the doctor must make sure that you give informed consent when you have a treatment. An informed consent is a form you sign before you or your children receive treatment, and when you sign the form, it says that you understand what's being done and why, and you understand the risks and the benefit, and you understand what other treatments you can choose, and you've agreed to that treatment. Another strategy is asking an advocate to help you through difficult times. You know, consider bringing someone to your doctor appointment, another person to be the ears that can hear what the information the doctor's presenting and what you're asking. Could be a family member, could be a friend. You know, if you're able to do that, it's really helpful. We want to also make you aware of, there's a new law that requires health plans to create programs that provide language assistance to all HMO members. And so that includes some interpreter and translation services. So you can ask for an interpreter to come into the doctor's office with you, and you contact your plan and make arrangements for that to happen, usually before the appointment. You can have someone there who can, to make sure that you clearly understand the information that you're being provided by your doctor. And, of course, trust your intuition. Goes without saying. Another key strategy is selecting a physician wisely and then communicating with them effectively. And, you know, most HMOs, you choose your primary doctor, and on their websites of the plans, the majority of them have the directory of the providers, and they can help you make the decision on who you want to choose. The information on the providers could be their location, their specialty, the sex of the providers, and the language the provider may speak. And the doctor's office should be easy for you to get to, usually within 15 miles or 30 minutes. And, you know, you can ask for a list of providers from your plan as well, or friends. And also know that you can change doctors if you don't like the one you've selected. And when you've selected the doctor and you've made the appointment, make the most of your visit. Bring a list of questions and concerns to your appointment. Take notes. And don't be afraid to question their judgment. Get clarification. The doctors must tell you, as I said before, all of your treatment choices, even if they aren't covered by the plan. And just make sure that you give informed consent. Another, be truthful. You know, it's a good idea to give the doctor the complete picture of the current health of the enrollee. Bring a list of your medications, even the over-counter medications and supplements you're on, and how much, what the dosage is that you take of each one. And make sure that you understand what what you talked about with the physician before the physician leaves the room. You want to make sure that that you've heard from the doctor if there's a treatment recommended, what are the risks, what are the benefits, ask them which treatments are most likely to help you, how much they'll cost, is it covered, what are the side effects. The big issue, I think, always is to make sure you repeat what the doctor tells you in your own words to make sure you understand. You can also ask the doctor how he or she can be reached between visits if you need further explanation or have other additional questions. And you have a right to ask for a second opinion, and that's advice from a second doctor. And usually people ask for a second opinion when the doctor's recommended surgery or a certain treatment or given a diagnosis that you want to double check, and they want to make sure it's the right decision for them. So that's another strategy you can use. Be a wise patient also means you follow your doctor's treatment plans. If you encounter problems, report them immediately. Know your medications, what the right medication is and the right dosage and the right time. Are you giving it correctly to yourself? And you want to be able to read the inserts of your medications, and you should know the indications and side effects of all medications you take. The pharmacists are always available to clarify any questions you have and concerns. And if you can't do it directly when you receive your medication, you can always call us and get the information you need. So the bottom line, do your research, know what options you have, and make sure your resources are credible. Okay. Next. That is. Okay. Now, I'm sorry, I'm looking for my page. Okay, now we've talked about being a wise patient. You've gone to your doctor. The doctor recommends treatment. What happens next? Well, the medical group, the Independent Physicians Association, or the plan will review the treatment request by the doctor and will make a determination on the authorization. So if the plan approves, the treatment's authorized. If it disapproves, the treatment's not authorized. And remember, Kaiser's a little different. We mentioned medical groups here, but that's all kind of one with Kaiser. The medical group is one big unit. And if the decision is non-authorization, you have the right to file a grievance with your health plan to appeal any unauthorized or denied treatment. Okay. The Knox-King Act Plan Service Act of 1975 requires that each plan licensed with the state of California provide a process in which the enrollee can dispute health plan actions. So again, you can look to your EOC to see specifically how how your plan's process and what you need to do. But basically, you can request an appeal in any format. You don't have to submit a request in writing, but you can. You can do it on the phone. You can do it online via the grievance forms that most plans provide online. Fax, you can do it. And you want to be able to, however you access it, that's the date of receipt is when the plan moves into action and starts responding to your grievance. The timelines for the plan response varies depending on what kind of an appeal it is. For a standard appeal that does not involve urgent care, the response time is 30 days. I also want to let you know, too, that the plans are required by law to, even if you call them and fax them, they are required to provide in writing to you within 5 days acknowledgement of your grievance. So they will provide you with an acknowledgement letter, and then they have 30 days, within 30 days to resolve the complaint, and they will provide you in writing their decision as well. If they resolve it within 5 days, you just get one letter. But that's a technical thing. But just know that they are responding to you in writing upon the receipt of your grievance. Now, the timeline for expedited appeals, which are urgent cases, is shorter. It's 72 hours. And it has to meet the legal criteria for an expedited review, which is established in the statute. So what this means is the condition posing imminent and serious threat to the patient's health, including but not limited to severe pain or the potential loss of life, limb, or bodily function. That will be considered for an expedited appeal. So there are different appeal times. We wanted to make you aware of that. And also we want to talk about the service denial type. If the plan does deny the treatment that's been requested, there's three different ways that the plan has determined to not authorize it. One, it's not on the bottom. It's not a benefit. It's not covered benefit for you, and that would be in your EOC. The other two would be the treatment is not considered medically necessary, or the treatment is considered experimental investigational. And we're going to talk a little bit more about how to respond to those as we go through our presentation today.
Oh, okay. It's my turn to talk now. So you've been to the health plan, you've got your denial, and you've been through the appeal process. What do you do next? And what we're recommending is you call the Department of Managed Health Care. As you can see, we have the strongest patient rights laws in the nation. And we at the Health Center is just part of the Department of Managed Health Care. And what we do here is explain your health care rights, help you understand how to use your health care benefits. We make sure the health plans follow the law and address member complaints. But we also have many divisions within the Department of Managed Health Care so we can look at the big picture. We can provide enforcement actions if we find the health plan out of compliance with the law. We can go in and require the health plan to make all the corrections to come back in compliance. We can enforce penalties and fines on them. We also have a division that looks at the plan provider oversight. We want to make sure that all of the divisions of the plan are financially solvent. We have licensing divisions that all the health plans have to file with the department any changes to their license, and we look at those and determine whether or not we will approve or disapprove that. And of course, we also have a legal services where we can go out and file suit against the health plans. Our goal here is basically getting the right care at the right time, identifying solvency issues for plans and providers, because the providers are contracted with the health plans, and so we're holding the health plans to make sure that their provider groups are financially solvent. We monitor the solvency of the plan groups and the health plans to make sure that the delivery of care is adequate. We operate a call center to take questions and complaints, and if your plan denies authorization for a service based on medical necessity, you can request an independent medical review through the department. A significant portion of the requests that we see through the independent medical review are overturned. Basically, we also have a survey unit that goes in and audits the health plans and makes sure that they are doing what they say they are doing. We're pretty proud of what our state has. We have the most advanced managed health care delivery system in the nation. California health plans, provider groups, and hospitals have formed a network that has historically provided good quality of care at a price lower than the rest of the nation. We see this system as something worthy of protection and nurturing, and we strive to better understand the trends in the healthcare marketplace, basically to stay ahead of the curve, so to speak. California has dual regulation. We have health plans that are under the regulatory services of the Department of Managed Health Care, and then we have some health plans that are regulated through the California Department of Insurance. The DMHC, we regulate all the HMOs and certain PPO products, basically Blue Shield and Blue Cross. We also regulate specialized health plans, prescription drug plans, and we require that all our health plans cover all medically necessary basic health care services. Now, the California Department of Insurance regulates most of the PPOs, that's preferred provider organization. They regulate most all of the EPOs, which is an exclusive provider organization, and most indemnity products. And indemnity products would be like the fee-for-service products. We have about 20 million consumers under our regulatory blanket, and CDI has about 1.3 million PPO enrollees, and then a lesser amount of the indemnity and EPOs.
Okay. Well, we talked about how to be a wise patient, but you also, enrollees have several health care rights that are important to remember. And first off, you have the right to receive care when you need it. You also have the right to have an appointment when you need one, and this includes also a right to timely diagnosis and evaluation for basic health care services. You have the right to have an appointment with a specialist when you need one, and you can ask for a referral from your primary care doctor or mental health care provider or your health plan. And in some plans, you may be able to make an appointment directly with a specialist. You also have a right to continuity of care if your doctor or medical group leaves your plan. And if you receive a letter from your health plan or have been told that your doctor or hospital is no longer going to be contracting with the plan, then you have the right to keep seeing your doctor or visiting a hospital if that's the service you were receiving. You have the right to do so, and this is called continuity of care. There are certain restrictions and there are certain conditions under which that takes place. But there is a listing on our website, a grid that gives you some examples of of the different conditions that are covered, and you may want to look at it. For example, the care of a child under 3 years old, you can keep the same services for up to 12 months. Okay. The other right you may have is to receive treatment for certain mental health conditions, and in California we have the Mental Health Parity Act that states that a health plan must cover the same or equal benefits for certain mental health conditions that they cover for medical conditions. And there's a list of 9 such conditions, including bipolar disorder, panic disorder, autism or pervasive developmental disorder, schizophrenia, children's severe emotional disturbances, to name a few. The other right you have is to get a second doctor's opinion, and your health plan should cover that. And you ask for that when the problem or the cause of the diagnosis isn't clear, you have doubts about the treatment for a serious health problem, or your treatment isn't working. And to do that, you ask the doctor for a referral, and your medical group or your health plan must approve your doctor's referral. Another right you have is to know why your plan denies a service or treatment. And if you've gone through the plan's grievance and appeals process, you will receive in writing, as I said before, why the service has been denied, and they should tell you specifically, cite the EOC or the clinical review guidelines that were used to make that determination. You also have the right to understand your health problem, and you have a right to see a written diagnosis and to give informed consent. You have a right to file a complaint and ask if you have a problem with your health plan, or your health plan will approve the treatment your doctor recommends, or ask for an independent medical review, and Lynn will talk about that in a few moments. if the plan has decided, made a decision to deny the care. You also have the right to choose your own doctor within the network, and you can change your doctor if you're not satisfied with the one you've chosen. You have a right to see your medical records, and get a copy. It's always a good idea to get a copy of your records. Also note, though, you may be charged for the copying, and you can add your own notes to your records too, which may be helpful as you proceed. You have the right to keep your medical information private. You can ask your doctor or health plan to contact you only in certain ways or in certain locations, or set limits on who sees your personal health information, or to whom your personal information has been given. And you also have a right to an advance directive that directs your doctor, your family, and friends on the health care that you need when you can no longer make the decision for yourself. The Health Center, I think, as Lynn mentioned, the Health Center is one of the divisions of our department, and our Health Center assists consumers regarding their health plan problems or questions. We are reviewing the issues that are presented to us, and we are making sure that the plans are following the law, and the care is being provided to members, the care that they're entitled to. We have the after-hours answering service that's available, and urgent matters are handled by on-call personnel. And our staff are consisting. We have 5 different divisions within our health center, and they consist of consumer healthcare rights experts, healthcare professionals, analysts, and attorneys. And we do a variety of tasks, basically, to make sure that the plans are following the law and members are getting what they're entitled to. What we do with the call centers, we educate callers on the DMHC jurisdiction, and people will call us even if there is a confusion whether or not you're a member of an HMO or not. You can still call us, and we can get information to you to help clarify that and give you phone numbers where if you are not a managed care but you're part of Medi-Cal, or you're part of the plan coverage, the PPOs that the California Department of Insurance covers, we can get phone numbers to you so you can contact them and continue on with your quest to receive the treatment that you desire. And we can identify a caller's need for appropriate resolution or referral. We decide whether it's a standard case, an urgent case. We have clinical staff here. We have attorneys. Everyone is working to make sure that the complaint gets to the right spot and can be resolved as quickly as possible. We educate everyone on the health plan grievance process, including what we can do. Plans, you are required to go through your health plan first to resolve the issue with them. And if it's not resolved to your satisfaction at the end of that 30-day period I mentioned before, you can file a complaint with us, and we can proceed and handle that complaint. We also we have sort of a more informal process that we have in our health center too, that we can quickly contact plans and bring the enrollee and the plans together for a quick resolution of a consumer grievance. If it takes everybody on a phone, we'll do it. If it's something that can be done very quickly, if a mix-up in paperwork or a confusion, we try to handle those and get that taken care of too. And that's something I think this call center or health center is very good at. We provide information and referrals to other agencies, as I said, and if the forms that we have that are online and on our website, or we can fax you our grievance forms, if they're confusing and you don't understand it, we'll help you fill it out. And of course, we do outreach as we're doing today. Okay, the call center, for those of you who are interested, is a 24-hour, 7-day-a-week operation. The phone lines here at our offices are open from 7 o'clock to 7 p.m. Monday through Friday. We do have an answering service that's available after those hours on weekends and on holidays, and your complaints are recorded and accepted. We also have a dedicated line for individuals who are deaf, and we can assist consumers in over 150 languages. We employ an interpreter service, but we also have staff members who are bilingual. So, we are able to, and for the urgent care calls, we have a nurse on staff who is able to respond to the urgent needs 24 hours a day, 7 days a week.
Susan spoke about the quick resolution. I just want to give you a little bit more information about this process. We do an awfully lot of quick resolutions every year, and generally they're handled swiftly by one of our call center agents, our phone agents, and we set up the system where we have specific contact sources at each health plan who will work in a quick resolution. And what we do is we try to pick agents with the health plan that have the authority to make some decisions. And I think that's really important because we want to resolve these issues in 1 or 2 days. And so we want to work with people who can make that happen. Now, there are certain criteria to have a quick resolution, and basically once we meet the criteria for that, we will get the consumer on the line along with the health plan agent, discuss the situation, and try to come up with a timely process. But generally, before you can go on the quick resolution, it'll only work for those consumers that have not filed an appeal with the health plan. And so that's basically the first thing we're going to look for. But it's a very good process, and we generally can get these issues resolved on the day we call or maybe within 2 days. That is our goal. For the urgent complaints, we have a process where if it meets criteria and the patient is at a health risk, our call center agents will immediately contact one of our staff nurses. Right now we have 5 staff nurses who resolve the urgent issues along with other duties they do for the health center. But an urgent complaint needs an immediate resolution, and so these are cases that cannot go through the 30-day appeal process with the plan because their condition will not allow it to take that long. They generally involve denials with filling of prescription medications, delays in obtaining specialty appointments, surgery when there's a pressing health issue and you can't get a surgery on the surgery schedule in a timely manner, or there's some confusion as to what type of surgery the consumer needs or is requesting and what the health plan is offering. One of the biggest reasons that we get weekend calls through our urgent nurse process is premature release from the hospital. The health plan has decided that you no longer meet the criteria to stay in the hospital, and they're telling you you have to go home. And of course, you or your family do not believe that your condition allows that at this time, and there's a dispute as into what your needs are. So the urgent nurse on a weekend will call, and basically what we'll do is try to get that release stopped until the consumer can go through the appeal and expedited the 72-hour appeal process. We also work with patients that have been unable to get referrals to specialty treatments or specific treatments not offered by the health plan's providers, not supported by their providers. Our urgent complaints are referred to the clinical staff when the consumer and the health plan can't come up to a resolution. Then the nurses will step in and try to resolve that. We also have a program where we look at other issues that are not of an urgent nature, but definitely are a big issue to our consumers. We get calls for our standard complaint resolution process that we need to address the quality of care either by the physician or by the facility. We look at continuity of care, and Susan spoke about that earlier, and what we have a process when there is continuity issues. Sometimes it can be resolved by the urgent nurse, but if it can't be resolved by the urgent nurse, then we have an early review process where we'll send it right away to an attorney, and then we'll look to see if they meet the criteria for continuity of care. We also look at financial and claims issues, billing problems, benefit coverage disputes. We'll have attorneys look at our contracts, and if the health plan's denied a coverage saying it's not within their benefit package, we have ways to look at that and review the evidence of coverage and determine whether or not the health plan is correctly applying the evidence of coverage. Eligibility and enrollment, disenrollment, all of those issues will be looked at through our early review, an attorney review. We look at inadequate access to care. That's a big issue with us, and we are constantly looking and going to the health plans in either our surveys or with inquiries to as whether or not the health plan is adequately allowing the patients have an adequate number of providers for the number of patients that they're covering. We're looking at access issues through legislative reform. We're working on that right now, and we rely on all the staff to let us know if they come up with trends where they're seeing a number of patients calling in with complaints that they're having too long a time waiting to see a specialist, and then we'll go to the health plan and have them provide us information as to whether or not they're meeting the access requirements. We also look at attitude and service concerns. If you're calling your member services and are getting the brush off, or your providers have poor attitude and not giving you the courtesy and the care you need, we want to know those, because we also track those type of issues and will step in to resolve them. Standard complaint resolution. By law, the consumers must first complete their health plan's grievance and appeal process prior to filing for a standard complaint with the DMHC. The only time that we waive that would be for those early review issues. You're about to be disenrolled from the plan, things that we can't wait 30 days to get resolution. The standard appeal process is 30 days, like Susan mentioned earlier. Expedited appeal would be 72 hours if there's an issue with disenrollment or other criteria. Like Susan said, all the consumers are going to receive resolutions from their health plan in writing, with the exception of the exempt grievances resolved by the business within the next business day in accordance with the Health and Safety Code. We also have here, and this is my pride and joy that I'm speaking about because I've run this program for quite a few years now. It's the independent medical review, and what that is this process is intended to resolve the medical necessity, reimbursement for emergency services, and experimental investigational disputes only. For example, if your health plan denies a health care service on the basis that the service is not medically necessary, you can request an independent medical review. If the service or treatment you have been denied is a covered benefit. That means they have not told you that it is not a benefit coverage in the letter that you'll get in the appeal. You requested a medically necessary treatment and received a decision from your health plan that denied, delayed, or modified your requested treatment as not medically necessary, or if the service is denied as experimental or investigational, or if it involves a reimbursement for emergency or urgent care services denied as out of network or out of plan. And if that denial has not been over 6 months since you received it. I lose my little cursor here all the time. You see it here? There we are. You're not eligible for IMR if you are a Medicare beneficiary or you're a Medi-Cal fee-for-service recipient. Medi-Cal managed care enrollee that has filed with a fair hearing with the Department of Health Care Services, or if you're in a self-insured or an ERISA plan, that it's the Employee Retirement Income Security Act, an enrollee who is disputing a workers' comp claim, or your treatment has been denied as not a covered benefit. This is how you can apply for an IMR. You can go online and to our website, the health.ca.gov, and download an application. You can call and we will send you an application, either fax it to you or mail it to you. And if your health plan is required to send you all the application for IMR in their denial letter. So there's multiple ways you can get that application. When you complete the application and send it to us, you can send any relevant material or documentation that you've accrued. That would include any medical records. In fact, it's very, very helpful if you went to an out-of-plan or an out-of-network provider, if you go ahead and send us those medical records from that provider when you file the application. And the reason for that is that your health plan is not obligated to seek out-of-network providers' medical records. So that means they may not have had those when they did your appeal, and if you sent them in for the appeal, then yeah, they'd be looking at them, but not necessarily they would have them. Once we receive those records, we will forward them to the plan and request that they review all the records that we received that were not reviewed by them. And then we allow them 5 days to do that review. We also, if you have a copy of the health plan's denial letter, send it to us. But if you don't have it, don't worry about that, because we're going to send off to the health plan and request that they send everything that they sent you also. If you have a statement from your provider establishing that the dispute is eligible for review, and that means they determine that it's medically necessary treatment. And any medical articles of support of the treatment you're requesting is helpful, because we will send that forward to the independent review organization. We ask that when you're filling out the forms, be very specific about the treatment you're requesting. Include any dates of service. If you've already had a service and you're asking for a payment, make sure that you include the exact dates of service that you're requesting a reimbursement on. Include any payments that you made, the in or out of network providers, and any extenuating circumstances, like if you went to an out-of-network provider because there were no network providers available or experienced in the treatment and care of whatever condition you're going to. That's very helpful for us. Our qualification process will go through, we'll get the health plan's grievance resolution. We'll review the IMR application. It'll be assigned to an analyst. All of our clinical staff review the IMR applications, and we also send them to legal for their look to make sure that the health plan was complying to the law in their denial. Cases are disqualified for benefit coverage, but we will convert them to a standard complaint and seek resolution through that process. Once it's qualified, the IMRs are sent to our review organization. What happens then is the decision is from the review organization will come back. We'll review it and make sure that it's an appropriate review done by the organization, and then once we determine that it is, we will adopt the decision. The decision becomes final once it's adopted, and it cannot be appealed by either the enrollee or the health plan. It can't be appealed, but if the enrollee sends us any new important information that was not reviewed by the review organization, for some reason you eliminated it, you forgot to send it, then we will send that on and see whether or not that would change their decision. The decision is put in writing to the enrollee. It's sent to the enrollee's physician and to the health plan. That decision also provides what we send to everyone is the actual physician's review and the reasons for their determination, along with their experience and some basic information about their knowledge about the treatment being requested. We also want you to know that all the decisions provided through IMR are posted on our website, and we are able to, the consumers are able to go on and list what type of service they're looking for and open up and see what the decisions have been made in the past. But keep in mind, science changes all the time, and what would have been an uphold decision 5 years ago may be overturned now. Let me find my cursor again. Susan's going to talk about Division of Plan Surveys.
One of the divisions in the health center is the Division of Plan Surveys, and what we do is we routinely go and survey at least once every 3 years every health plan that is licensed by the Knox-King Act. And the survey areas, this is just there's sort of a connection to everything we do. We are looking at survey areas such as quality management, access and availability, grievances and appeals, utilization management of the plan, the continuity of care, prescription drugs, access to emergency services and payments. And there's certain regulations and statutes and regulations that the plans need to comply with. We are also looking at how they are operationally handling it, and the information that comes to our call center is kept, we have data on it, and we are always looking at that data to give us an idea of how that particular health plan has handled access issues, or grievance and appeals, or continuity of care? Are there issues with prescription drugs? We use all this data when we go out to survey the plan, so there is a real, we're trying to fill in the gaps. We don't want any holes. We're looking at everything. If there's a need to go in and do survey a plan prior to their routine survey, we have something called a non-routine. We investigate and respond to pressing concerns that may have been presented to us regarding issues of the plan operation, and they may be out of compliance. We also have those as well. Our surveys are posted on the website, as are the IMR decisions, so you're free to go and look up the plan. And the listing of all the health plans is on there too, and their phone contact information. So again, we want to say, go to where you can get more information. Our website has a lot of information on it. We encourage you to get a chance to now surf around and see what we have and see your answers. See if your answers can be your questions can be answered there. We also give you in the PowerPoint information on our California Code of Regulations, Title 28, that we follow, that are the regulations to the Knox-King Health Plan Service Act of 1975. And the key thing on the bottom is the call help center number. It's 1-888-466-2219. And please feel free to call that with any questions, complaints. We're here to help, and we hope we've given you some helpful information today. Thank you.
Thank you, ladies. So now's the time that we can take some questions before we sign off, and we've had a number of questions come in by typing them. If you're able to, you can go ahead and raise your hand, and I can call on you and unmute you. That won't work for everyone if you don't have a mic, but why don't I start going through some of the questions that have already come in. One from Riva says, when you said Kaiser is different, does that mean that we do not go to you for denials that one would want to dispute?
No, what we meant when Kaiser was different, what we were alluding to was that most health plans contract with different medical groups, and the medical group is actually separate from the health plan. It's contracted, but it's not 100% regulated by the health plan. Kaiser is the only one that is both the health plan and the medical group. But it's the same process. You still have to go and get an appeal. What's difficult with Kaiser sometimes is getting the denial to get the go-to appeal. They'll basically try to maneuver you the direction they want you to go instead of giving you an absolute no, you cannot have that. But you have the right to request the denial.
Okay. All right, Stephen, I'm going to try unmuting you. Stephen, you there? Stephen, one more try. Okay, go ahead and type in your question, Stephen. Okay, another question we have is you talked about criteria for expedited response from the health plan or an expedited IMR. Would irreparable developmental delay be criteria?
That's a touchy one. We would look at that if the plan said that they would not expedite an appeal for that type of issue, I would still recommend you call the department here. Our nurses will look at it and contact the health plan. You know, if it truly does not meet the criteria for the 72-hour expedited appeal, we'll get on there and try to broker what we call a fast-track appeal and get something resolved in like a week. Our nurses will assist that. I mean, if there's any way that they believe that it would meet that criteria, they will go to the health plan and try to work that out.
Okay. Stephen's question came in. He says, the second opinion is, sorry, that's not Stephen's question. Stephen says, the new healthcare reform that was just passed, how will this impact lifetime maximum benefits and yearly maximum benefits?
The national healthcare reform. You know, we're still looking at the healthcare reform. We've got a team of lawyers downtown looking it over. We're working on some talking points. When you just look at what they say, it appears that they're going to eliminate lifetime caps, but the department can't speak on that right now. There's still a lot that we're looking to see how it's going to affect our regulated consumers.
Okay. We have a question from Fada. She says, what if a treatment is denied as not a covered benefit, even though it is? Per AB 88, health plans regulated by California must provide all medically necessary treatment. Couldn't health plans use this not covered benefit as a delay or stalling tactic?
You know what? It would be looked at by our attorneys. If they determine that it's a stalling tactic, then yes, then we would consider that a delay and move it. But anything like that would have to go through our attorney's review first.
Okay. Connie asks, if you have an old dispute from 2008, can it be submitted for review?
You know, if the denial is from 2008, you can request that the health plan either re-review it, or you can go ahead and send in the complaint or application for IMR, but you'll have to include any circumstances why it took so long to file it. We do have the right to waive that 6-month criteria, and so, you know, that does come up. We do waive them in situations. So, you know what? And sometimes the health plans don't pick it up. They don't bring it up as an objection. And if they don't object to it, then we move it forward. So, you know, it never hurts to try.
Okay. Let's see. We have another Kaiser question. Does the second opinion have to be in network? This is important because in Kaiser it would be difficult to find another doctor who would question the first doctor's diagnosis or treatment plan.
Yes, that is an issue, and we recognize that. However, the Kaiser does have the right to request an in-network second opinion if they have someone who can provide that opinion with the experience and background to provide that opinion. I mean, we get a lot of complaints where they say, well, I want a doctor that has experience with pediatric endocrinology, and Kaiser doesn't have specialists in that field. So we will look at those. I mean, if you send us that complaint, we will look at it and make Kaiser come up with their credentialing and how they went about determining that that was an appropriate second opinion. And we've got around it, you know, sometimes, and so, you know, that's something that we will definitely look at.
Okay. What is the timeline for standard complaints to be resolved? Is there an enforcement authority attached to a standard complaint issue?
Yes. If the health plan does not give a resolution in 30 days, we consider that a grievance violation. And we would file a grievance violation on them, and there would be a fine.
Okay. And let's take, since we're at time, I'll take one more. And if folks have other questions, they can always email me later. And we can work on getting you answers. So the last one is, how is it determined if something is a basic healthcare service?
Well, the basic healthcare services are timely and a timely diagnosis and evaluation, a comprehensive treatment plan, and also being able to have medically necessary care and access to networks is sort of the overall what we look at.
Well, it has to be. The definition still has to cover that. It's hard to explain. I got to think about this. It has to be a medical or psychiatric service. You know what, Tara, it'd be best if I sent you the definition.
Okay.
Because I would much rather you get a thorough and complete definition than something that we may have omitted.
Okay. There was a let's see, there's one follow-up to that question. They're asked, is applied behavior analysis a basic healthcare service? Do you know?
Well, that again, we're not going to talk about a specific issue. If there's a concern that an individual has a complaint about, then please go through the process that we talked about today and submit it to our department. As Lynn mentioned, we will take every complaint and look at it, because we don't want to put any restrictions on anything, because every case is specific and different, and we want to consider each case individually. And please just send the information in, and we'll look at it and go from there.
That's great. Thank you so much. This is such a great resource. And for those on the call today, you'll get a follow-up email with a survey to help us keep this program running. So please take the time to complete the survey. You'll also be receiving the PowerPoint slides and a copy of the video of the presentation for today. Next month's webinar will be on Wednesday, May 5th at 12 o'clock, and we'll welcome Sherry Novick from the First Five Association of California. And if you have any questions, or if any of your questions didn't get answered, please go ahead and email me and we'll get those answered for you. And thank you so much to Lynn and Susan.
You're very welcome, and please call us, because we will find the answers out for you and assist you any way we can.
Wonderful. Thank you so much.